So I am super excited to talk about the elemental diet with Debbie and Dr. Roy Steinbock. And this is going to be a great conversation. The elemental diet. Again, I might have briefly spoken about it with regards to SIBO. And while it could help with SIBO, it could also help with other conditions, which of course they will talk about. And so let's go ahead and dive into their bios here. So starting with Dr. Roy. Dr. Roy Steinbock is a board certified pediatrician with an integrative and patient centered approach. He believes that investigating the root cause rather than only addressing symptoms is the best route to achieving and maintaining optimal health and well being. Dr. Roy combines evidence based Western medicine with a functional and mindful approach. His area of expertise includes digestive disorders, allergies, eczema, frequent and recurrent illness, pandas, anxiety, OCD, ADHD, and other difficult to treat cases. And Debbie Steinbock is a certified holistic health coach and nutrition counselor with a special interest in digestive disorders and autoimmune disease. Her 20 plus years in clinical practice includes working with complex conditions that often involve gastrointestinal disease, thyroid imbalances, food allergies and sensitivities, nervous system dysregulation, and more. And Debbie brings a uniquely personal perspective to her work with clients that was gained by navigating her own health challenges. Debbie's deep personal understanding, combined with a passion for and commitment to continuing education and research, makes her a compassionate clinician with an insightful perspective. Dr. Roy and Debbie are the co-creators of the Elemental Diet Success Plan, a step-by-step roadmap that teaches participants their proven tips and strategies to complete an elemental diet with clarity, direction, and confidence. And thank you so much, Dr. Roy and Debbie.
Thanks for having us.
Thank you.
Yeah, very excited. And let's just talk a little bit more about how did you start focusing on the elemental diet? Again, you do a lot more in your practice, but this is the only program I know of, the Elemental Diet Success Plan, that, yeah, again, I don't know any other practitioners that have like a program dedicated to the elemental diet. So what led you to create this?
So I have been using elemental diets in my clinical practice for almost 25 years now. And really, the elemental diet gained a lot of popularity back then with inflammatory bowel disease. So I would use it with my clients that had Crohn's disease or ulcerative colitis. And then it was about in 2013 when I met Alison Siebecker and learned that the elemental diet was being used for SIBO, that I was like, wait, are we talking about the same elemental diet that I had been using in my practice before? And so at that point, we really dove into the research of it for SIBO and also learned about all these different conditions that the elemental diet was being used for, and kind of expanded in our combined clinical practices what we would be using it for. And that's kind of how it was all born.
In addition to also, we decided to try the elemental diet ourselves.
Oh, right.
And that was huge, because once we went through it and we saw how both it was on one level quite challenging, but on another level it was actually quite doable. And Debbie sort of being who she is and the magic of her practice, which is, paying so much attention to the details, bringing all the tools together to make her clients become very successful. I mean, prior to doing the Elemental Diet Success Plan, Debbie had like a 99% success rate with getting people through the elemental diet. There's always a few people, of course, who, are maybe overzealous in their desire to do it and then decide that they just can't do it. But anyone who wants to really can make it through it. We found that first in Debbie's practice, and then she turned that into our program.
Yeah. And like Roy said, I had known that I wanted to try the elemental diet myself. And it always, I was using it in more extreme cases. So somebody that had, Crohn's, colitis, they're very symptomatic, that, it hadn't really dawned on me to use it for something that wasn't potentially like dangerous or life-threatening condition. And so, so when I decided to try it for myself, Roy always says that when I get into something, I can find the bottom of the internet. And I would every day, I'd be like, look what I learned about it for rheumatoid arthritis. Look what I learned about it for this. And literally it was like a few days before we were going to get started, Roy turned to me and he was like, I think I want to try it with you. And I was like, oh my God, are you serious? And so it just made it that much more fun that we got to experience it together.
It was. And we're so different that we actually had really different experience doing it. And that was, I think, really valuable for, as a starting point for our knowledge base as well.
Yeah.
One of the reasons that we were only using it for really extreme cases is because the initial formulas that were out, the medical shakes that you could get, oftentimes prescription only, were absolutely disgusting and really, really not palatable. And so you had to be really miserable to want to actually drink that for several weeks. But because of the work of Dr. Pimentel and Alison Seibecker, bringing it a little more to the forefront, companies have started making shakes that—
And Ginny Patel-Thompson.
Right, and Ginny Patel-Thompson. Shakes that are actually not disgusting. I mean, I don't know that I would call them delicious, but you, after a few days, you're kind of like relatively happy to drink them. You get used to it, and it is totally doable now, whereas before they really kind of tasted like vomit.
For those who are not familiar with the elemental diet, can you talk a little bit more about what it consists of? Like what's in the powders? What are you actually drinking with an elemental diet?
Yeah. Do you want me to start?
Sure.
So like you just said, elemental shakes are basically like it's a powdered medical food, and the nutrients get combined with water to make a shake. And the shakes basically combine like all the nutrients that humans require, to live off of for, an extended period of time. And you can go into detail if you want with more what that looks like.
Yeah. So sometimes typically for SIBO, people will do it for 2 weeks or maybe 3 weeks. But for other conditions, for example, like Crohn's disease or ulcerative colitis, people can do it for much longer periods of time, sometimes for 6 weeks. And then sometimes people will even do versions of the elemental diet where they're not doing 100% elemental diet. They're doing kind of what we call like a partial elemental diet, where they'll drink some of their calories as shakes and eat some of their calories as food. And there's actually some really good research, particularly with Crohn's disease and actually even Crohn's disease in pediatrics, where they showed significant improvement for people who had kind of very difficult to treat resistant cases, doing even a partial elemental diet for up to 12 months.
So what I was going to say too is that when you break down like what's in the elemental shake, so everything is broken down in its elemental form, so its most simple form. And so what that looks like is that there's no protein in the shakes. Typically, when we say an elemental shake, it's just free-form amino acids. There are some semi-elemental shakes, and they're now classified as semi-elemental. They were actually used to be called elemental, that have some short chain peptides like dipeptides and tripeptides. But generally, like the definition of elemental means that it's just free-form amino acids. And then the carbohydrate form of everything is monosaccharides. So your really simple sugars, which are glucose, fructose, and dextrose. You can also add in, it's acceptable to use glucose polymers, which is like maltodextrins. Those are the only like acceptable carbohydrate sources in elemental shakes. And then we have fats, and fats really can be any kind of fat, but most common would be like MCT oil, flaxseed oil, or fish oil. And then we basically, they add in nutrients and electrolytes.
Yeah,
and,
like vitamins, minerals, electrolytes. So it's basically everything you need to survive for a period of time. We always kind of say it's not like a health food diet. This is not like a diet I recommend everybody goes on. But if you're suffering from inflammatory disorders, digestive disorders, it's an amazing gut rest and rest from inflammation, and can even turn significant inflammation around.
Yeah, we can talk about some of the benefits if you want.
Yeah, let's go for it. So you said where it gives the body a rest, the digestive system a rest, helps with inflammation. Someone has gut inflammation. So yeah, let's talk more about some of the benefits of an elemental diet and why people with some of these conditions, SIBO, you mentioned inflammatory bowel disease. Even I think I heard in some of the interviews you've had on other podcasts, like could help with some autoimmune conditions. I'm not sure what Hashimoto's, but I know you mentioned like rheumatoid arthritis. I don't know if you've seen a success with like thyroid autoimmunity, like Hashimoto's, Graves as well. But yeah, I'll let you take over.
Yeah. So, I mean, So let's talk about the conditions first, and then maybe about the mechanisms of how it, why it's so powerful. So the different conditions that have been studied, and some that haven't been studied that we've actually seen, kind of our own little mini clinical studies, have been, so like you mentioned, arthritis, autoimmune arthritis, like rheumatoid arthritis, and there's studies both in pediatrics and in adults with that being very successful. For Crohn's and colitis, it's actually the primary mainstay treatment, first line treatment in many countries, like Japan, some countries in Europe. So, someone gets diagnosed, they don't get put on a biologic like they do in the United States. They get put on an elemental diet, and the remission rates are huge. And then also things like really difficult to treat cases of eczema, food allergies, other food sensitivities, resistant celiac, chronic pancreatitis,
eosinophilic esophagitis.
Yeah, eosinophilic esophagitis. So not specifically, I was kind of digging in to see if there was any specific research with thyroid, and there really isn't. I mean, there's obviously a significant tie between hypothyroidism and SIBO. And so, because of the issues with peristalsis, and that can be caused by hypothyroidism, that can lead to SIBO. So it's very common to see that comorbid condition together. So it can help with treatment of that. But we haven't seen anything specific for treating autoimmune thyroiditis.
Yeah. And what I've been asked that question a lot, because I don't have to tell you, Eric, how common thyroid disease is. Many of my clients have done elemental diets who have thyroid disease. And what I always tell people is I don't think that 2 weeks is going to lower someone's thyroid autoimmunity. What it's doing is, we know that the gut is behind all, autoimmunity that's happening. So I think anything that's working to rest, heal, seal the gut is going to help with autoimmunity. But again, these 2 week elemental diets, which is really what most people are doing, I don't think is long enough to make an impact on thyroid hormones, but make a dent in it. Yes.
I mean, yeah, I don't think it would hurt. And it's probably relatively good in general. I think because thyroid, at least in my experience, seems to be more of a smoldering autoimmune condition. It's sort of crippling in the long run and kind of pervasive in every part of your life, but it doesn't typically, in my experience, have these huge flares, let's say a Crohn's or colitis flare, where you're really debilitated in a relatively short period of time. Or something like rheumatoid arthritis, where you can have these really acute flares. We can have that with thyroid, but it's less like that. So it's a little harder to see the improvements as well, because I think the other thing I've seen with thyroid is as you improve, it also kind of happens slowly. It's not usually you don't get this a one treatment, all of a sudden you feel 100% better from thyroid. So, it takes your body time because of the way the thyroid works with, energy production in the body, energy usage in the body. It kind of takes a while. I usually tell people people improve after being on the right dose of thyroid for 3 months. It's not right away. People don't generally feel better right away in my experience. So I think it's harder to tell if this would help. But the ways that it works in a bunch of different ways. The most obvious way and the most kind of studied way is the stuff that's being seen with SIBO. And that's really because of the elemental components, the fact that everything is absorbed incredibly high up in the digestive tract. So really super high up in the small intestine.
And rapidly.
You don't need to digest anything. So things are just absorbed. And therefore, you don't get any substrate or food for the bacteria. And after a period of several days, 4 or 5 days, the bacteria begin to starve. And that's the benefit. And we know that overgrowth of bacteria in small intestine is inflammatory. Even large intestinal bacterial overgrowth can be inflammatory. So that alone is well studied and well documented, and that's a huge part of it. But they've actually shown that even some of the free-form amino acids themselves have significant anti-inflammatory, so decrease pro-inflammatory cytokines and increase anti-inflammatory cytokines, just the amino acids themselves. And then in addition, that it's kind of like a fast, except for that you're not fasting calorie-wise. So you're basically giving your digestive tract an opportunity to really rest. You're not really putting in solid food. You're not needing to digest. And therefore, you're decreasing the amount of energy that your body's using towards inflammation and digestion in the gut. And I think that's really important for healing as well.
Mm-hmm.
Anything I missed?
Yeah, no, I was going to say what you're speaking to is really the hypoallergenic nature of the shake.
Yes.
is that, you know, they're typically either free of allergens, or, you know, there are some elemental shakes that do use, you know, some corn or some soy products, but they're just broken down. You know, I always equate it to like, you know, hypoallergenic infant formula, where they're just broken down into such, you know, tiny pre-digested pieces.
And the large majority of people can tolerate really almost any of the shakes, though, because of the nature of the clientele that we see and the people who tend to seek elemental diets, there's some people who are very, very, very sensitive. And if they don't tolerate one, they might try another one and be quite successful. We've had a few people who don't tolerate one shake and then tolerate another.
Yeah. Yeah.
Have your clients tried any homemade? I know Dr. Alison Seebecker has her homemade formula. I don't know. There's probably other ones out there, or is it typically the ones that are pre-made that they're taking?
Yeah. So I say that it's a testament to the benefit of elemental diets that year after year, more and more companies are coming out with elemental shakes. So, you know, just in this last year, we have like 2 more that are in our basement for us to invite some friends over and sample with us.
Yeah, believe it or not, we actually do that.
Yeah, but more and more companies are coming out with these pre-made formulas, and the taste has just gotten so much better over time.
Yeah.
So yes, I have had clients and participants in our program who use Alison Seebecker's homemade formula. I would say that generally is done for one of 2 reasons. So one is accessibility, like they live in a country where elemental shakes are not as available to them.
Or only by prescription. Or
only by prescription. And then the second reason is that, as where I spoke to, that person is really sensitive and they want to very much control everything that's going into the shake, you know, ingredient by ingredient, and kind of pick and choose that way. But otherwise, and I think she would agree and say this too, the pre-made formula is just, the flavor profile of them is so much better than the homemade shake.
Okay, now that's good to know. And then, do you use it as a starting point with your SIBO patients, or is it something where you maybe put them on an herbal antimicrobial protocol or rifaximin, and then if they don't respond, give the elemental diet? Or does it depend on the person? Like, maybe you speak about the elemental diet as an option, and then depending on how they're reacting, like, I'm not sure if I want that. Okay, let's start with something else and then see how they respond.
Yeah, it's a good question. So I always say it's really self-selecting, because people seek me out to do an elemental diet with me. So I get a lot of clients that are really interested in elemental diets. And that may be because they have failed other treatments before, or that might be that they do a SIBO test and their numbers come back so high that when they're faced with the option, it's like 2 to 3 weeks of an elemental diet, or potentially 3 courses of antibiotics, 12 to 16 weeks of herbs, you know, okay, I think I could muster it up to do this for 2 to 3 weeks, you know? So yeah. So for us, it's really like, I mean, a lot depends on the person and what the person wants. You know, you don't want to twist anyone's arm into doing an elemental diet. But if it's something that they're willing to do, we want to give them the tools to do it appropriately and easily.
And I think because we've both personally done them and we've had so much success, Debbie's guided so many people successfully through elemental diets, and we have more testimonials than we could put up, honestly, of people's like incredible success. And oftentimes there's these amazing like success side effects. Like people will, they didn't do it for their fat, you know, they have back pain every day and neck and shoulder pain and, you know, aches and pains, and they get dramatically better from that, even though that's not why we did it. So I think because we sell it very enthusiastically, and because we've seen so many successfully people do it, and we can guide people through getting through it really successfully, I think we probably use a lot more than other people. In pediatrics, generally I start honestly with medications, and mostly because of compliance, because even the meds are several weeks, and sometimes you have to take multiple medications depending if they have hydrogen and methane SIBO, or just methane SIBO. So, and the compliance on the herbs is very challenging. And a lot of the kids don't swallow pills, so we have to, you know, crush up tablets, things like that. So I tend to start with that. And if we get success, it's also harder to follow to get kids to do this. I mean, I can get most of my kids' parents in my practice to think about an elemental diet. We've done it with some teenagers really successfully and a few younger than teenagers, but much more in adults.
Makes sense. So 2 to 3 weeks in the case of SIBO, is that usually enough to eradicate it? Or like what happens? I'm sure again, it depends on the person. So if someone follows the elemental diet for let's say 3 weeks, I don't know if you do a follow-up blood test or if you just go
Mhm.
by symptoms, but let's say sounds like you do blood tests. Let's say if it's a lot better, but maybe they still not quite where they need to be. I guess what approach do you take then? Can they go an extra week or two, or at that point, if it's, do
Yeah.
you, yeah, anyway, I'll let you answer the
Yeah, yeah.
question.
It depends on the person. So, we have jokingly said this many times, so you may have heard us say this, that like there are some people that finish their last shake and are like, I will never touch this again. And then there are other people that finish their last shake and they incorporate shakes ongoing into their healing toolkit. So when a client, specifically with SIBO, what you're asking for is we will do follow-up breath tests. And, generally, I've been saying for years that I think it's 85% effective for both hydrogen, methane, and hydrogen sulfide SIBO. And the research had only been from 2004 on hydrogen SIBO. I heard Mark Pimentel speak recently, and he did a study on methane SIBO and found that same success rate, which, like I said, I've seen for years. And so generally we see an improvement, even if it's not 100% eradication. And so for those people that still have some SIBO, they might choose to go back on the elemental diet, or they might choose to just kind of follow things up with an herbal protocol, or sometimes one course of antibiotics.
Mhm.
It's really individual. I say often that what I'm trying to flesh out with my clients is like the stress that continuing on the elemental diet is causing versus the healing benefits that it's providing. And anytime someone gets into the situation where they're just simply like white knuckling it and they just don't want to do this anymore, I believe that that's really a stress on their body. And then it's not really the same healing tool.
And some people have the opposite reaction where they are feeling so good on the elemental diet that if you tell them to do another week, they'd do it happily.
Yeah, exactly. There are some people that are
That's the
afraid to
minority,
go
though.
back on food because they feel such a relief from symptoms that they're afraid that food is gonna, cause their symptoms to come right back.
And do you take a similar approach with inflammatory bowel disease? So ulcerative colitis, Crohn's disease, where you give them the option, just talk to them about the elemental diet. Because I think Dr. Roy, you mentioned in the case of inflammatory bowel disease, they could actually be on it longer. I think you said maybe 4 to 6 weeks.
Yeah.
Yeah.
So people do elemental diets for, I think, around up to 6 weeks, like 100% elemental diets. But then, we use it in our practice a few different ways. In addition to, so I think that answers the question is yes, we'll and if people need to be on it longer, they can be. I think if you're going to go even past 3 weeks, because our program, for example, is self-led, so you can do it by yourself. I think doing 2 to 3 weeks, as long as we have contraindications of when you shouldn't do it and things like that. But as long as you fit the mold of, which is like 99% of people who can do it very safely by themselves at home, that's fine. I think if you're going to go past like 3 weeks, you probably should be under the supervision of at least a very well-experienced nutritionist, dietitian, medical physician, something like that. Because at that point, you're really kind of eliminating, you're also shutting down all your digestive functions in your body, and you need to know how to kind of return that back on. Even after a couple of weeks you do, but even more so the longer you do that. So that's not something I'd experiment with at home by myself. Yeah, but we do use it in other ways in the practice as well. Do you want to talk about like the other ways that we do it, like the rests and the resets?
Sure. Yeah. So in the case of inflammatory bowel disease, a lot of times if somebody's still like, because with inflammatory bowel disease, we have markers that we can be monitoring. So we might be monitoring someone's fecal calprotectin or their SED rate or ESR. And, generally we'll see those coming down, but we won't necessarily keep someone on an elemental diet until those have completely normalized. Again, if the stress of the diet is just, too great for them. So you can in those cases specifically, we'll often transition someone onto a half elemental diet, or partial elemental diet is what we really call it, because it's not really half, where they might continue to consume shakes a portion of the day, breakfast or breakfast and lunch, and then do like a well-tolerated whole foods dinner. And a lot of people can do that ongoing for, an extended period of time. Just as an example, my sister, who has a plethora of different autoimmune conditions, she did an elemental diet last summer through our program. And she still, to this day, her afternoon snack is an elemental shake, because she likes it. It gives her that like period of bowel rest in the day. So, so there's ways to extend it like that. And then, as Roy just said, we also teach people about how to use them ongoing, where they might do like an elemental diet reset, something where we have some clients where very quickly they'll feel the anti-inflammatory benefits 1 to 3 or 4 days. And so they might go back to an elemental diet after, they go on vacation and they indulge and kind of things flare back up for them. That just, a short period of rest, bowel rest, doing an elemental diet, can be very helpful for them to not kind of continue a downward spiral, but to kind of go back on the ups.
How about SIFO? So we spoke about SIBO, small intestinal fungal overgrowth. Does the elemental diet help with that, as far as you know, or what you've experienced in your practice?
Nobody knows.
We don't know.
It's not been studied. In theory, because again, the carbohydrates are being absorbed so high up, and fungus love carbohydrates, so they can eat other things as well. But you would think that it would have a similar effect. Early on, there were concerns that you could actually exacerbate fungal overgrowth, because the early shakes, and some still do, have really high amounts of carbohydrates and sugar. And so there were concerns. And so we have at times put people on either antifungals, pharmaceutical, or more so herbal, just to prevent that. But it doesn't seem like that's really the case.
Yeah.
We really haven't seen that be an issue. And even in groups that Debbie's in a group with larger number of people who really treat a lot of SIBO, and it doesn't seem like fungal overgrowth's like an additional fungal overgrowth if you didn't have SIFO to start off with, or if you had mild SIFO, that it gets worse. So it doesn't seem like it gets worse, but no one specifically studied that, so we don't really know.
Yeah, there's some practitioners that hypothesize that it also treats SIFO, but like I said, we really don't know. And when we did an elemental diet ourselves, like this was really when that next generation of shakes were coming in that use the glucose polymers and were lower in carbohydrate content. And that was a question that I had for us, like, do I put us on a prophylactic antifungal treatment? Because that was what we were doing previously with these older versions of shakes. And generally, if people can tolerate it, we do that, because they're tolerating it, and we may be helping treat an what's the word I'm looking for, like a comorbid case of SIFO at the same time.
Yeah, and because most people do tolerate it, pharmaceutical antifungals like nystatin are not systemically absorbed. They're really relatively tolerable for most people, and some people feel great after taking a course of nystatin in general. And same with using kind of more like, again, something botanical. We've just had really, really good tolerance, except for really with the most sensitive.
Mm-hmm. Yeah, but can I add one thing here? One thing to add is that what we don't recommend people do is throw in a whole slew of supplements or medications. Not that people really throw in a slew of medications, but more supplements while they're on an elemental diet, because an elemental diet, as you know, we're restricting those complex carbohydrate. And so even like cellulose capsules, things that people with a lot of these conditions often want to take would not be considered elemental. And so we don't want to put in all this effort to do an elemental diet and then be taking handfuls of pills that are counter to an elemental diet.
Also, it's, depending on what pills you're taking, some of these pills are very difficult to tolerate on an empty stomach.
Yeah.
Yeah, that makes sense. And that was one of the questions I was going to ask you. So would you recommend typically not taking any supplements or just minimal supplements? Like if someone was taking magnesium and I don't know, vitamin D, for example, and a fish oil, would you say just take a break from those while following the elemental diet?
Generally, yes, because the shakes have all that stuff in them. There are times where we, might add in like a select number of supplements, but really just to like address a condition that somebody has more than just like, they don't need vitamin D that's in the shake. They don't need fish oil. There's fatty acids or oils. Yeah, exactly. In most of the shakes. So it would be like maybe we need to add some magnesium citrate because their bowels got really sluggish and backed up on an elemental diet.
But we don't kind of like prophylactically start with that. We do it on a case-by-case basis. And we actually, in the course, we go over like how to decide whether you need that or not.
Exactly.
Just with a handful of supplements, we keep it really simple. We probably say a million times that we're elemental diet purists. The elemental diet is so powerful. You don't need a whole lot when you're doing it. Especially if you're doing it for SIBO, just do the elemental diet.
Mm-hmm. Yeah.
How about coffee, tea, herbal teas?
So technically, okay, well, let me say it this way, because I was answering for SIBO. So for SIBO, technically you can do some weak coffee and some weak teas on an elemental diet. We do not recommend that both in our program and with our clients. We want this to be bowel rest, and to have a bowel rest diet that involves, caffeine is generally not the direction that we want to go in. So, what I tell clients, like I've used this example in a couple times I've spoken, that I had a client that was drinking a pot of coffee a day. She's a nurse and would work the night shift and would pretty much just drink coffee to get herself through her night shift. And when she contacted me to do an elemental diet, we really worked to wean her off of caffeine before she started. And a few times during her shift, she would have a half a cup of coffee while she was on the elemental diet. And that was, such a huge improvement from where she was at. And she had amazing results from that elemental diet, like completely got off her prescription laxatives that she had been on for years and was having normal bowel movements afterwards. So long story.
And stayed off of caffeine for the most part.
And stayed off of caffeine afterwards. Exactly. So I think if people can get off of caffeinated teas and coffee, that's best. Herbal teas, you can definitely drink. I'm a little bit more specific about which ones when somebody has SIBO. If they're doing it for another condition like IBD or rheumatoid arthritis, really, any teas are going to be careful. But I do think about like the roots and carbohydrate content of certain teas, again, if we're specifically dealing with SIBO.
And one of the things that I think is really special about the program and kind of was in Debbie's approach prior is that there's a whole preparation phase. So the program is not like buy the shakes, drink it, anyone can do that, right? With preparing your body for the optimal success, and not just success through eradicating SIBO, but just to have general, really good foundational health. So I know in the holistic world, some people are very pro coffee, and there are maybe some benefits to it. And I certainly had been a coffee drinker during my residency and many years of college as well. But I can tell you that removing those things just generally makes you feel healthier. It just really does for most people. So it's not mandatory to get off caffeine, but we do find that people feel better when they do.
Okay. No, thanks for sharing that. So ideally, avoid the coffee, avoid black tea, probably green tea too, since it has some caffeine, not a lot, but still avoid pretty much anything with the caffeine. And then herbal teas, it really depends on the herbal tea.
Exactly.
But yeah.
But you have to prepare yourself for that. If the last thing you want to do is if you're like a pot a day drinker, then to stop and start your elemental diet, you're going to feel absolutely
terrible. You're going to feel horrible.
Yeah, no, I agree. I mean, same thing. When I can't say I put a lot of people on the elemental diet, but if I'm putting someone on an elimination type diet, usually I'm going to recommend for them to take a break from coffee and other things with caffeine in there. And yeah, if they're drinking 3 or 4 cups a day, it's not a bad idea to gradually decrease. I mean, there are some people, I'm sure you've come across people who are like, oh no, I could just stop, and they actually do stop, and it
Yeah,
seems like they're okay, but more times than not, that's not the case. So
totally. And then there's people like me who feel the caffeine hit from white tea and can't even drink white tea because we're so sensitive to caffeine.
One thing I
yeah.
wanted to just jump back to for a second, I know it's a little far back in our conversation, but I think it's important to mention is that, we mentioned that elemental diets are used as first line for Crohn's and colitis. That's not what our first line is generally. I mean, if someone came in and was really inflamed, and really, really in bad shape, that might be our first line for them. Generally, we start with more holistic approaches, health promoting approaches, looking at things like removing coffee from their diet, looking at their diet, really a more kind of foundational, functional, holistic, whatever you want to call it, approach.
Mhm.
That's where
Food
we
and
start.
free,
And
stuff like that. Yeah. Yeah.
we have a ton of success with that. I mean, not everybody who has Crohn's and colitis. I mean, I'd say it's still relatively a minority of the patients with Crohn's and colitis that we see that end up on elemental diets. So this is really more for the people who have done the foundational kind of health promoting, really holistic approaches, and then are still suffering, or if they come in at a really bad shape initially.
Yeah. And one thing I'll just add to what Roy says is, people that have inflammatory bowel disease, I think a lot of the time live with that fear of what if the bad flare up happens? I've been pretty okay now, but I've read X, Y, and Z and it can get worse. And I always tell people that it makes people feel so good psychologically to know that this tool exists that they can have in their back pocket. Because a lot of, at least my clients in particular, they don't want to go on some of these heavy hitting drugs, and they're kind of, maintaining on some of the less heavy hitting drugs, but they think, oh my God, if things turn for the worse, that's where I have to go. And I don't want to go that way. And like I said, knowing that the elemental diet is an option for them brings a lot of relief for them psychologically.
Yeah, especially because one, they feel better, but we can also measure markers of inflammation, like Debbie mentioned, the calprotectin, the ESR, the CRP, and that's really useful. It's a nice tool to have because it does kind of mirror how they're feeling most of the time. And then if their markers are great, then they can decide for themselves whether they want to be on medications or not. If their markers are still not great, then of course we need to look a little deeper, and maybe medications are appropriate at that point.
How about side effects? You did mention constipation potentially, and then the magnesium citrate if someone is experiencing constipation is maybe an option to consider. Anything else people should look for if they're like going through your program, and then
Yeah.
anything common or I guess even uncommon but might be concerning?
Yeah, you used a good word because we have 2 lessons in our course that go through this. There's the psychological side effects that people go through of not eating food.
Challenges, really.
Challenges, right, exactly. And then there's the physical challenges of being on an elemental diet. So let's speak to the physical ones because those are the ones most people are curious about. So, as far as bowel stuff, it can be literally all over the board. And Roy and I were like opposite ends of the elemental diet spectrum when we were on.
We're on opposite ends of the physical spectrum. It's hard to, we say this in every podcast, but it's hard to tell because Debbie's sitting on a cushion, but I'm like a foot. I'm a foot taller than her. So
yeah. And naturally our bowels go in different directions. And, and on an elemental diet, many people go to the extreme of what their bowels generally gravitate toward. So some clients that have slower transit time and motility will end up with constipation. We always point out that an elemental diet was actually used by NASA to send astronauts up into space because it produces little fecal matter.
It's very low residue. So therefore, some people don't produce a lot of poop.
Yep. So some people get really constipated. So not really constipated, really low fecal output. It's not actually
but they don't feel constipated.
Right.
They don't have abdominal pain. They don't get distended. They feel great. They're just not having
low fecal output. Whereas other people are like a breastfed baby where everything comes out just looks like it did in your, baby's breastfed or bottle fed diaper. And that is also completely normal. So, a lot of what we're doing is preparing people for what we call par for the course normal, so that when it happens for them, they don't freak out about it. Okay. So the things we have people looking out for are changes in their bowels, changes in their energy level, brain function, blood sugar regulation. There's oral symptoms that can come with an elemental diet that are by nature of not eating and chewing. Things change in your mouth as a result of that. What are other common things? I mean, people have to think about how their relationship with exercise when they're on an elemental diet that falls into energy and blood sugar sometimes. They can get any side effects of die-off, microbial shifts. That's what we're going for here. Those are going to sometimes say those bacteria sometimes are not going to go down without a fight. And so, as the lipopolysaccharides, get into people's bloodstreams, they might feel the side effects of die-off, and that can feel headache, flu-like, muscle aches, fatigue, brain fog. So the other thing that we teach people is we have a detox support guide in our program that's like, how do you do the things? Because you can't go to binders. That's not elemental, So we teach people like, what are the things you can do on an elemental diet that'll help you, move those toxins through your system.
Yeah, the other thing, and I think this is really important, is that though most people do feel some symptoms typically, they're not going to feel all of them. And they're probably not going to feel bad the entire, even people who don't, like, I felt great on that elemental diet and Debbie did not.
Yeah.
But she didn't feel bad the entire time. And we've not really seen people who just feel terrible the entire time.
Exactly.
We've had a couple people who psychologically struggle the entire time.
Totally.
It depends on where they are. Usually they're kind of taking it on at a time where they need to do it for their health, but they're just not really prepared for it.
Yeah.
And so they can white knuckle through it. But that's a really tiny minority of the people that we've guided.
Yeah. And I'm glad you pointed that out, because what we often say is that, in the beginning, we didn't know how people would react to this. And we can speak now with this confidence of working with hundreds of people one-on-one and hundreds of people through our program, that we have not seen those people that just feel absolutely awful the whole time. It really does just like come in pockets for people.
So the last thing I wanted to ask you, like like we spoke about specific conditions like SIBO and Crohn's and ulcerative colitis. For someone, let's say they've been undiagnosed, maybe they went to a gastroenterologist and everything looked okay according to the endoscopy and whatever other testing they did, and maybe that same person got a comprehensive stool test, and for the most part, I mean, usually we're going to find some dysbiosis, but nothing like screaming out. And
We
same
call
thing
that
with
garden
the
variety dysbiosis.
Exactly.
Yeah.
That's our term for it. Your garden variety dysbiosis.
Exactly. So overall, the comprehensive stool test looks okay. The SIBO breath test, they do that, it comes back negative. And we know no test is perfect, but I guess that's the point too, where like it looks like everything's okay, but and they've done like elimination diets, they followed all these different types of diet and they're still having gut issues, digestive symptoms. So it sounds like there's no harm for a person in this situation to give the elemental diet a try for 2 or 3 weeks.
I would agree with that. And you said the keywords that I was thinking is that they've tried the other things, meaning that they've done like a whole foods diet, some sort of elimination diet of allergens, like, as long as they've done all those things, and I used my sister as an example, the only thing she's been diagnosed with is Hashimoto's, but she has like very, how would you describe it? Like autoimmune.
Yeah, it's kind of like mystery autoimmune kind of thing.
But nobody's like really put their fingers on it.
But there isn't a name or an exact diagnosis, but it's clearly inflammatory autoimmune.
Exactly. And so, and I'm even running a client through right now that's in that same boat where there's just kind of this like, the picture of this person is just kind of screaming inflammation, but there's not really like the diagnoses to support it. And oftentimes an elemental diet's incredibly successful for those people.
The other thing too is that then allows them to, let's say it's kind of an extreme elimination diet, right? Because you're literally eliminating all proteins, which tend to be the bigger issue. I mean, of course, fats and carbohydrates can cause problems as well, but the proteins generally are the bigger issue. And then you can really introduce things very slowly, because we don't recommend people finish an elemental diet and then go eat a cheeseburger. Yeah. Right. So you have this opportunity, this unique opportunity, if you're feeling great, to then start introducing things really slowly and then kind of see which foods you're reacting to. It's kind of a nice clean plate.
Yeah, no, that makes a lot of sense. Well, this has been great. I mean, this is, well, definitely the most in-depth anybody on the podcast has gone into with regards to the elemental diet, and probably will in the future, unless if, we have you back for an update, in the future, as far as the elemental diet. But is there anything else, anything that I should have asked you that I didn't ask you, or anything else you want to talk about before we wrap up about the elemental diet?
So the only thing that comes to mind for me, and then curious what you say, is, and I think we touched upon this a little, is that we often say that sometimes when people hear about elemental diets or hear us speak about elemental diets, they get really excited and they want to try it. But what we always tell people is that it is something that you should absolutely plan for, understand what you're getting into, understand the side effects that you might experience. And, and we kind of are, the term that we always say is that those people who plan are really planning for their success. And so I think that the more someone goes into it, educated, thoughtful, understanding what to experience, understanding how to transition off of it, what testing they might want to do before and after, they generally will have better results than the person that, kind of like 2:00 in the morning, listens to this podcast, feels desperate, orders it, and starts the next day,
Which there seems to be a decent number of people who do that.
Yeah.
The other thing I would say is, and in addition to what Debbie said, also having the time to order the shakes, knowing which shake to order, because there's the variety and different ones can be used for different conditions. So again, we go over that in our program.
Yeah.
The one thing I think we didn't talk about, which I think will be important, particularly for people who are really suffering with chronic illness, is the weight loss. So we get a lot of people who are, particularly again with inflammatory bowel disease or even SIBO for long periods of time, who are really struggling with keeping on weight. And they get worried that they're going to lose weight when they're on the elemental diet. And though you do generally lose a little bit of weight, kind of what we call like water and poop weight, because you actually have a decent amount of poop in your body. And so you're not putting any solid mass in your body, so you're not going to gain your daily weight that you're doing. Most people can either maintain or even gain weight. And again, people with significant digestive and absorption issues can actually gain weight better than they could on regular diets because it's so highly absorbable. So they're getting the nutrients. You can even build some muscle mass, especially if using semi-elemental diets. So there's a lot of little details. And again, we do try to cover pretty much most of that in our program.
Yeah. And I even spoke to on some recent podcasts that, like, we had a client that has Crohn's disease, and she got her period back a few days into the elemental diet. And she hadn't had it for, years after having 4 children and because of IBD. And while that sucked for her, it was such a great sign that her body was actually getting nutrients that it had not been getting, that she was able to get her period again. So a little bit of a tangent, but there's a lot of details to think about, as Roy was saying, in terms of, how people's bodies are going to respond.
All right. Well, this has been amazing. And let's go ahead, and if you could tell people where they can find you, the website, if you want to. I know throughout this presentation, you spoke about the elemental diet success plan. So if there's anything else you want to briefly talk about with that, of course, we'll include links to the show notes. You also have your 5 free diet tips. So where could people find out more about you?
Yeah, they can find us at mindfulfamilymedicine.com, and you'll learn about both me and Roy there.
Yeah, it's our shared website.
Yeah, it's our shared website, exactly. And then under our programs tab, you'll find the Elemental Diet Success Plan. And
some other programs.
Yeah, exactly. We have a couple other programs. And what I was going to point out is, what I've added in recently is, after launching the Elemental Diet Success Plan, what we learned is that there's some people that, even with all that information, really just want that one-on-one support through the elemental diet. So there's a separate program that I call One-on-One Elemental Diet Guidance, which basically just combines the Elemental Diet Success Plan with check-in sessions with me along the way, so that they can, make sure that they have their plan clear before they get started and along the way. And then I'm available for questions that they have as well.
All right. Well, wonderful. Well, again, thank you so much, Dr. Roy and Debbie. It was great chatting with you. And I'm sure the listeners learned a lot about the elemental diet, and I learned some things as well.
Thank you so
Thanks
much,
for
Eric,
having
for
us.
having us.
Yeah, thank you.